Right now, you're probably at the stage where you know what you don't want, what you don't like about your body. But before beginning a procedure, it's important to have a clear picture of what you do want. That's what this video will help clarify for you. It will show you what's possible with labiaplasty so that you can make an informed decision about what exactly you'd like to change. To do that, we want to start by looking at the entire area as a whole and talk a little bit about anatomy. This area is the outer labia. This is the inner labia. This area is called the perineum. This is the clitoral body, and this is the clitoral hood. Before surgery, we want to develop a plan that takes all of these areas into account. Let's start with the outer labia or labia majora. There are three main reasons most people want to change this area, known sometimes as the camel toe area. 1. The labia majora is loose, like you see here. That's called laxity. Second, this area can also lose volume. You can see an example of that here. And third, it may be too big or too full, which you can see an example of here. In labia majoroplasty, we typically make hidden incisions in this area and, similar to a facelift, simply remove loose skin. In some cases, we'll also add volume using fat or other fillers after the loose skin is removed. Together, we're able to go from what you see here to a look like this, which is much more uniform. When it comes to the inner labia or labia minora, some common complaints are that the area is too large, the edges are too dark, or a general unevenness, examples of which you see here. Prior to any procedure, we'll first want to determine what we want the final appearance to be, as well as how it will relate to the rest of your anatomy. For example, we don't want to simply remove portions of the inner labia because it may make the clitoris more prominent. So we'll address both of these areas together. Again, we do this so that the overall end result achieves your desired outcome. The procedure can be very aggressive if you prefer a very clean look, similar to what you see here. However, it's important to be aware that there are some potential long-term side effects associated with this, dryness being one example. That's one reason most women choose a more balanced or less aggressive approach, which results in a more natural look with the inner labia allowed to protrude slightly. Whichever route you decide to take, we always want to consider what the inner labia looks like in terms of its relationship to the outer labia. The third area we address is the clitoral hood. Typically, about 90% of women will address this and the inner labia simultaneously. It's important to mention that many women are concerned that they'll experience a loss of sensation as a result of surgery to this area. However, the vast majority of the nerves entering here come from deep inside the body. Simply removing excess skin is extremely unlikely to cause any loss of sensation. In fact, we can perform other procedures during the surgery to actually enhance sensation. Finally, we have this area, called the perineum. Women often opt for perineoplasty because of loose skin in this area, which can be cleaned up, or because of looseness, which might typically occur after childbirth, resulting in a U-shaped perineum, as you see here. By tightening the muscles and tissue around the entrance to the vagina, we can achieve more of a V look, which many women prefer. You can see an example of a U-shaped perineum here, which is prior to surgery, and a V-shaped perineum here, which is the end result we're typically able to achieve. Whatever your reason for considering surgery, rest assured that we'll work with you to combine our expertise with your vision to co-create the look you desire.